The doctor is in, and this morning we're talking about treatment for eating disorders. Here to tell us more is Tim Bromley, Director of Behavioral Health from OSF St. Francis Medical Center. Thanks for coming in.
Sure, good morning.
Boy, talking about eating disorders, 30 million people in the U.S. have them. It's still a big topic, but today we want to focus mainly on our young kids. School's starting up again, and I would guess that a lot of eating disorders maybe come from someone not feeling good about themselves, maybe due to someone else saying something about them. Talk a little bit about that.
Yeah, a lot of times the patients we've worked with have talked about one of the triggers being teased or being commented about, either their weight or the way they were eating. And so I think, as teachers and parents are aware, as returning to school, as their loved ones and the students report things about bullying or report about fat shaming or eating, that it can be a trigger, it can be a warning sign, and at that point start trying to look for any kind of dramatic changes. If a child comes home and says, well, I'm going to change my eating dramatically, I'm going to go on a diet, I'm going to lose this weight. Again, it may be a good intentions, but it's keeping an eye on how devoted they are to it, how much they go too far or just stay at it longer than what would be reasonable. It can be a warning sign that they're tying their self-esteem to that need.
Yeah, and by eating disorders, we're talking about anorexia, bulimia, binge eating. What are some other signs parents can look for?
So restriction or loss of weight. You can also see changes in weight, rapid weight gain possibly. There are people who, just because of the frustration, the emotional vulnerability to those types of things, instead of trying to lose weight, they actually use eating to comfort themselves. And so when they get bullied for weight, they may actually eat more to gain weight. And so binge eating disorder can be a problem there. Then you have the people who sort of fall in between, who may eat, occasionally overeat, but then they're doing something about it, usually they're vomiting or laxatives to do that. So frequent trips to the bathroom right after eating can be a warning sign. And just, usually people who are really commenting negatively about their body on a regular basis can be a warning sign.
Sure, and how do parents get the ball rolling in terms of addressing the problem?
Yeah, so first step would be to try to contact and go to a primary care physician and get evaluated there, especially if they've lost a lot of weight. But we also have services where we have outpatient counseling and nutrition counseling, as well as day treatment programs. But we have a free support group service on Thursdays at 4 o'clock that both parents and loved ones can come to, and the individual who's struggling, just to get more information and understand more about eating disorders and how they can help.
Very good. Well, we're going to have all this information for you to review on our website, ciproud.com. Tim, we appreciate you coming in. Good information.
Yeah, great.
Thank you. Don't go anywhere. We'll be right back.